morning, viewers. What we're going to talk about today is how chronic pain is formed. Most of the time when somebody has had an injury, it can be a whiplash injury, it can be a twisted ankle, it can be any simple injury that you may experience. It can, if not treated properly, spread. Now the reason why it spreads is we talk about centralization, is if you, for instance, hurt your arm and then it shifts up to the neck, because your central nervous system is in your neck, so your spinal cord, which controls everything, once it reaches to the neck, it can cross over to the other side of the body. If you've injured your neck, so in instance getting a whiplash injury, or your lower back with a disc lesion or picking up something heavy, these, because they are already centralized, because it's in the middle of the body, they can irritate the nerves, and because the nerve that's in the middle supplies both sides of the body at the same time, they can initially do the one side of the body where the main injury was, but then cross over to the other side of the body because it's the same nerve that's been affected. Once you've had that, we could talk about primary trigger points and secondary trigger points. Primary trigger points is where the initial injury, so if you, for instance, hurt your neck, these muscles in this area will be influenced and painful. However, each of these muscles refer to a different spot. So your upper trapezius will refer to your temples, and then you can get temporal trigger points there, which would then be your secondary trigger points. Your scalene, which is in the front of the neck, refers pain down the arm, and then you can get a biceps, triceps, forearm trigger points, and even hand complications. So when you've had a whiplash injury, the muscles that are usually influenced are your upper trapezius, your scalene, and your sternocleidomastoid. Many people forget to treat the sternocleidomastoid muscle, and this one is quite prevalent for causing dizziness, ringing in the ears, spots in front of the eyes, face pain, tooth pain, spatial disorientation, watering of the eyes, red eyes, headaches on the front of your head, on top of your head, and at the back of the head, ear pain. Sure, that's quite a few symptoms that I've mentioned there. And when those three muscles are working together, causing havoc, then it can cross over to the other side of the neck, and then you get a full injury there. And then once the neck is compromised, within a couple of months, it will go back down to the lower back and compromise that. And once your lower back is injured or painful, these trigger points will then refer down to the buttock area. And when those buttock areas are activated, it will refer down to the legs. And I mostly treat chronic pain patients that have been injured from a whiplash injury or some other injury many years ago. And since then, they've been suffering with headaches, back pain, neck pain, arm pins and needles, leg pins and needles, or leg pain, arm pain. And on average, it takes me about a year to help return these people back to normal function, where they can go out and do normal daily activities, they are able to start exercising, and they are basically pain-free. But it's a lot of dedication, a lot of time. They come to see me on a regular basis. They get lots of homework to do to reverse the problems. And that's what we need to do, is focus on getting those 6 things that we need to improve in our health. And we'll talk about those in the next talk. But that is how chronic pain is created. So you must make sure that you get back to full range of movement and full function with no pain by seeing a physiotherapist on a regular basis. If you can't afford a physiotherapist, go and see a massage therapist, but they must be good. You can't just have a half a job done. I prefer to use the massage therapists that do use cupping. So go and find those, find a physiotherapist, and combine it with a lot of massage to release the trigger points, as well as exercise and stretches to improve your flexibility and your strength, because those will also compromise the area. Thank you for watching. Please send to your friends of those that you know are struggling with chronic pain, and please let's see what we can do to help these people return back to normal. But you must get treatment, otherwise you're going to struggle on your own. All the best, and tune into our next session. Thank you very much for watching. Bye.